Well, this morning, the doctor is in. We are talking about ways to stay on top of our heart health. So important. Joining us this morning to fill us in on the most common conditions and what can cause them, Dr. Paul Nona, cardiologist from Trinity Health Michigan IHA Medical Group. So good to see you.
Thank you for having me.
You're making it very easy for me to understand everything. We've been chatting a bit during the break. How do you know, like, what are some of the most common things that can go wrong with your heart, and are there different signs for different things?
Yeah, no, I think that's a great question. So, you know, as a general cardiologist, I focus mostly on heart disease, and there's a lot of different manifestations of heart disease. There can be something called coronary artery disease, which is blockages of the blood vessels that supply the heart, and that can kind of manifest in many different ways, but sometimes we think of it as chest pain or shortness of breath with activity. There's also different type of heart rhythm issues such as arrhythmias. Sometimes that may feel as a heart skipping a beat or heart going too fast. There's also signs and symptoms of heart failure and valvular disease that may represent signs such as shortness of breath or swelling in the legs. So I think it's very, common to kind of be aware of your health and look to see what signs and symptoms you're manifesting and seek out professional opinions.
You know, I know when people are a little bit younger, they may not think about problems with their heart. They may think it's someone who's older that has the issues. But really, this can affect people of all ages, and we've seen like tragedy even with younger folks in athletic practices. So at what age should you start seeing a cardiologist, or is that a decision that your primary care doctor makes?
Yeah, so I think it's a very individualized decision. I think, taking a full assessment, I think the key to good cardiac health is to have a good relationship with a primary care provider that's assessing, your cardiac risk factors, assessing family history, assessing if you have any other comorbid conditions, any other risk factors, and then deciding. Definitely if you have a family history of heart disease, you have a first-degree relative, whether that be, a sibling, a parent, or an offspring that had heart disease early, I think it would be beneficial to get evaluated. And we have multiple different types of testings that we can help assess your cardiac risk.
Let's focus on that a little bit about the family health history. It's just heart disease, heart attack, other things like that?
Yeah. So I think for the main thing is, we see there's a subset of populations that are more prone to developing coronary artery disease, and that's basically blockages of the vessels of the heart arteries. And there's a multiple of risk factors, high blood pressure, diabetes, tobacco use, sedentary lifestyle, but there's also genetic predisposition that
that was my question.
Yeah, allows for accelerated progression. So if you do have a family member, usually we say a male first-degree relative above who had a major event before 55, or a female before 65, there might be some genetic predisposition going on, and I think it would be beneficial for you to get evaluated by a heart specialist.
Real quick, how often do you have to do that? So start at a certain age and go every year? Or?
I usually recommend a yearly visit with a heart specialist if you do have that heart history.
All right. Thank you so much, Dr. Nona. You've been so helpful during this Heart Health Awareness Month.
Thank you.
Thanks for being here.
The doctor is in, and it is American Heart Month. The cardiologist here from Trinity Health, Dr. Paul, he is offering us some guidance on what to do to keep our hearts strong and healthy and prevent heart disease. So welcome back, Dr. Paul Nona. This is one of those things that's really a concern for all of us because so many people experience this issue.
Yeah, no, that's correct. Heart disease is one of the leading causes of death, and a large portion of the population as we get older are now dealing with heart issues. And there's definitely some lifestyle modifications we can do to help keep us healthy and prevent heart issues later in life. A lot of the times when we're younger, we think we're invincible, and we don't realize that some of our actions might have later implications for heart health as we age.
So when we talk about prevention, we talk so much about diet and exercise. What are some of the things that we're doing at a young age that are setting us up? And I know there's genetics and family history and those types of things, but what kinds of things are young people doing that they should or should not, because this could lead to problems later?
Yeah, so I think for sure we want to focus on having a heart-healthy diet, so limiting processed foods. We want to focus on having a good amount of physical activity. So I usually like to recommend 30 minutes of moderate intensity aerobic exercise daily. We also want to limit our vices. You know, we all have some vices. Definitely want to stay away from tobacco use, try to limit alcohol consumption, and actually, you know, be proactive with your health. You know, I think now we're in a kind of shift in healthcare where we're empowering patients to know their step count, know their blood pressure at home, know their sleep schedule. We're in a world where we have access to all this technology and personal health data that we're actually allowing patients to try to be involved and invest in their health care.
Right, so use these tools
exactly.
to educate yourself and keep yourself maybe on a schedule, whether that's exercise or sleep. How does sleep actually impact our hearts?
Yeah, I think definitely we should all be aiming for 7 to 9 hours of good sleep. And also I believe, you know, a lot of us might have undiagnosed some sleep apnea or sleep conditions that can lead to, you know, later heart conditions. So I think it's very important to, you know, pay attention to when you wake up, are you feeling rejuvenated, rested? Are you snoring? If you're overweight, these can all kind of lead to symptoms and signs of, you know, sleep apnea, which has other manifestations of heart disease.
Well, and so often, you know, we just look at these issues that all kind of come together. So, you know, heart health and obesity and diabetes. I mean, there's all these things that, you know, are all sort of connected. What are your thoughts on these new weight loss drugs in terms of heart health?
I think there's a role for them. I think nothing will ever be as good as, you know, caloric restriction, regular exercise. A lot of these medications, they have a role, especially in cardiac health, but there's also side effects. And I think there's no replacement for good diet and exercise. So I think that would be the standard of care. If you're someone that needs a little bit of more help or some guidance with some pharmacotherapy for that, I think it's definitely reasonable to talk to a healthcare professional. But I would do it as adjunctive therapy.
Absolutely. Okay. And then in terms of when we talk about diet, you said stay away from processed foods. We just did something yesterday about people switching to these like high protein diets. But if they're going to do that, that can also be problematic, the study said, for heart health. So you want to be careful about what you're eating in terms of even proteins.
I would agree with that. I like to think of it as if it has a label, I consider it processed. So if you see a label on it, it's somewhat processed. So I'd say, you know, focus on a Mediterranean diet. So fruits, vegetables, nuts, lean meats, fish. If there's anything too processed, I'm not saying completely avoid it, but limit it. Know your vices.
Thanks, Dr. Paul. We so appreciate you being here. Of course, get your doctor's appointment schedules, get in there for the testing, and eat right. So thank you so much.
Thanks for having me.